A veneer is a thin layer of porcelain that we bond on top of the teeth that will help dramatically improve the aesthetics of persons who are getting them. There's a lot of people who can be candidate for veneer. People with discolored teeth, people who have little spaces between their teeth, people who have chipped teeth, people who have minor overlapping of their front teeth. Any one of those can be a candidate for veneer. In my experience with my patients, dental veneers last for a very long time. It really has to depend on the combinations of patient selections and the selections of the material, but most of the time the veneer lasts for a very long time, 10 years plus. Your veneer will look very natural. We'll make sure that the veneer that we're going to be delivering to you will fit very well with your face and with your smile, and it will provide you with an excellent and natural appearance. One of the most difficult procedures in dentistry is to do a single veneer, because we're trying to match the color of one veneer to your natural teeth. But we can be able to do this. A lot of times if we're trying to do more of a smile makeover, then we have to do on 8 teeth just to provide a better smile and better distributions of veneers and color. There is a fundamental difference between a veneer and a crown. A veneer is a thin layer of porcelain that will be applied to the outside portions of the tooth, versus a crown that will require the grinding of the tooth structures all the way around. The advantage of a veneer is that you need very minimum preparations of the tooth structure, but sometimes even if we wanted to place a veneer, we can't do it because the tooth might have a large restorations or large composites or advanced decay that will require the placements of a crown. But as far as the aesthetic quality, you can get excellent aesthetic quality with a veneer, and you don't have to cut your tooth for a crown just to get the same aesthetic result. In my experience with my patients, veneers last for a very long time. They look natural, they function very well, and they really provide excellent aesthetic and quality for my patients. They look natural because I take a lot of time into building it in the lab, so I can put a little layers on top of it. So when you look at it, you can see that it's a natural, gradual smile that a lot of my patients will like it and love it. What you need to do to get a veneer is you need to come in, let me take a look at it, evaluate your smile, the length of your teeth, get some photos, make some models. I will then sit in the lab and I'll look at all these things together, and I can come up with the best shape, length, color for the veneers that you will like. And then the actual appointments will require minimum invasive procedure. We have to prep the teeth just a little bit. You will be walking out with a nice looking temporary, and the subsequent appointments you'll come back, and then we go ahead and we'll bond these veneers, and that will be it.